Madam President, I come to the floor today to discuss last Tuesday's 2020 Democrat presidential debate, and specifically to discuss the topic of health care. Despite all the political posturing, here's the key takeaways. Number one, the Democrats still want to take work-earned health insurance away from 180 million Americans. And number two, the Democrats want to raise taxes on the middle class and on all Americans to pay for it. Under the Democrats' plan, people will lose forever the health coverage that they earned at work. That means union workers, their hard-fought health benefits, they'll disappear. It means that Nevada food service workers, Michigan auto workers, all will lose their earned health care. Elizabeth Warren and Bernie Sanders want to replace work-based insurance with a one-size-fits-all government-run scheme. At the same time, the 2020 Democrats want to give free, taxpayer-funded health insurance to illegal immigrants. Hard to believe, but that's the matter of fact. That's the Democrats' so-called Medicare for All plan. Well, really, it's one-size-fits-all government-controlled health care, and it is extremely expensive. Even more expensive, Madam President, than I mentioned before on the floor because of a new study that's come out by something called the Urban Institute, a liberal group. They've just reported the cost of Medicare for All would be $34 trillion. That's 34 with a T, $34 trillion. So let's put that into perspective. How much money is that? Well, over the next 10 years, that's more money than we'll be spending on Medicare, Medicaid, and Social Security combined. It's an astronomically large number. So the Washington Post recently did a story, and this was the headline: Will Medicare for All hurt the middle class? It makes sense. Will Medicare for All hurt the middle class? Their subheadline is, Elizabeth Warren and Bernie Sanders struggle with questions about its impact. And we've seen them struggle about the impact of this very expensive one-size-fits-all plan. Now, the story notes that Senators Warren and Sanders are scrambling to ease concerns over middle-class costs, because that's what people are concerned about in this country, Madam President. It's the cost of health care. Working families back home in Wyoming, and talked with many this past weekend at our University of Wyoming homecoming football game, people from all around the state, they are not fooled by what is being offered by the Democrats in their debate. They know that they will have to pay dearly if the Democrats' scheme is adopted and ever signed into law. Well, the Washington Post story, they quote and cite Ken Thorpe, who is an Emory University health policy chair. This is what he says. He says, the plan is by design incredibly disruptive. He goes on to say, you create enormous winners and losers, and he adds, there is no question that it hits the middle class. Well, for the middle class, it's a double punch in the gut, and here's why. Not only will the middle class lose their insurance, but their taxes will go up as well. So still, now Senator Warren, she will not answer the middle class tax increase question, won't talk about it. She dodged the question again and again and again. And as the Post reports, the senator says she'll release a plan to pay for her proposal, as she said, in the next few weeks. But at the same time, she continues to duck the tax question. Last Tuesday, she repeatedly tap-danced around the issue on the debate stage. In fact, Senator Warren's debate performance reminded me of the Artful Dodger in Dickens' novel Oliver Twist. She said out-of-pocket health care costs will go down. That's what she said. Yet she failed to mention that much, much more will be taken out of middle-class pockets in huge tax hikes. So, Madam President, it's interesting when you see how this is covered around the world. The British publication, The Economist, well, they know a lot about socialized medicine. They've been living with the British healthcare system for many, many years. And they point out that Elizabeth Warren repeatedly refused to say she would pay for the plan. They say she ducked the question 6 times. During the debate, it was Senator Sanders who jumped in to set the record straight. Bernie Sanders said, quote, "I don't think it's appropriate to acknowledge that taxes will go up." He said, "I do think it is appropriate to acknowledge that taxes will go up." Now, he's even promised to raise taxes on lower-income Americans, because what he has said, he said, if you're making more than $29,000 a year, and I'm not talking about an individual, he's talking about a family here. If you're a family making more than $29,000, you will be paying more in taxes under the plan that is promoted by Bernie Sanders and Elizabeth Warren. Then there's the warning from the University of Chicago economist Catherine Baker. She said, these are going to be huge tax increases. She said the tax brackets may have to shift. And last week's Wall Street Journal editorial was headlined, "Warren's Middle-Class Tax Dodge." It explained the whole thing. It said the only way to pay for this plan is to raise taxes on the middle class, which is where the real money is. So to sum up, while Senator Warren continues to dodge the tax issue, Senator Sanders admits Medicare for all will raise taxes on just about everyone. Under the Warren-Sanders plan, middle-class tax raise, we will see taxes even rise for lower-income families. We're talking about family income $29,000. Here's the bottom line. Americans will not tolerate insurance going away and will not tolerate taxes going up. They want to keep their health care plan, and they want it at a lower cost. So we have a choice to make. We can work together to lower costs without lowering standards, or follow the 2020 Democrats pushing for their $34 trillion one-size-fits-all plan. Don't let this artful Dodger Act fool you. Senator Warren and Senator Sanders support the same plan. They won't lower health care costs, but they will raise everybody's taxes. They won't improve care, but they will take coverage away from 180 million Americans who now get it through work. Now, as a doctor, I want to improve patient care. I want to make health care more affordable. Republicans are 100% committed to protecting patients with pre-existing conditions. We continue to work on bipartisan solutions, real reforms to lower the cost of everyone's care. Meanwhile, the solution we heard last week on the debate stage, the 2020 Democrat solution, is to force all of us to pay more, to wait longer for worse care. That's what they've seen in Canada, it's what they've seen in England, and that's what we will see in the United States if this one-size-fits-all plan were to ever be placed into effect. Let's give patients what they want, which is the care they need from a doctor they choose at lower costs. Thank you, Madam President, and I yield the floor.